Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon and welcome to our Partners in Learning and Care, a back to school and out of school time childcare forum. My name is Kiami Harris. I am the Director of Learning and Events at Childcare YMCA of USA. We're really excited to have you join us today. Before we get started, I wanted to make sure that you knew about some of our features and to let you know that this session is being recorded. All of the slides will be sent to you in a later email along with resources and links that our presenters will be sharing. Our co-moderator today is going to be Jennifer Drake. And again, I want you to take out your phones if you have your phone with you. Next slide, Fallen. Because we want you to let us know what your professional affiliation is. So if you would text 22333, and then once you do that, text CCAOA to let us know what is your professional affiliation. And we'll be able to see that pop up. We want to know who's here today. Thank you. I see you all starting to join in. And while you're doing that, I want to let you know that you can ask questions today in the question and answer box, and we will try to get to as many of your questions as possible. We're really excited for this forum today. Thank you. So if you're just joining us, we're asking that you text CCAOA to 22333 to let us know what your professional affiliation is. Awesome. Great. So I want to take the time to introduce to you our Director of the Emergency Child Care and Technical Assistance Center, Jennifer Drake, who will introduce our presenters for today. Jennifer?
Sure. Thanks, Kiami. We'll wait. And next slide, please. I'm delighted to welcome you to today's forum and to introduce our wonderful panel for today's conversation. We will be hearing from Dr. Gracie Branch, Associate Executive Director, Professional Learning at the National Association of Elementary School Principals, Dr. Heidi Rosenberg, Director of Research for the National Center on Afterschool and Summer Enrichment, Dr. Dion Daubin, Senior Director of Research here at Childcare YMCA of USA, Heidi Ham, the Vice President, Programs and Strategy at National After School Association, Heidi Brasher, Senior Director of Product Line Cohorts, Strategy and Innovation Movement Services, YMCA of USA, Alexia Tex, Partnerships Manager at National CACFP Sponsors Association, and Dr. Lynette Fraga, Chief Executive Officer of Childcare YMCA of USA. And to kick off our discussion today, we'll actually begin with opening remarks from Dr. Fraga.
Thank you so much, Jennifer, and welcome everyone to our first webinar in a series named Partners in Learning and Care. Now, our intention in convening this forum is to both share information and dialogue with you as experts and advocates, as administrators of programs, as childcare resource and referral agencies, and others during this unprecedented time, about how we can best provide support and services and education and enrichment for our school-age children in partnership with families. As we navigate these uncertainties, we likely have many more questions than answers. However, we are certain of the wisdom of the field and our collective commitment to be in service and to be informed by the best data and information available to solve the challenges before us. We acknowledge that not all voices are at the table today, which is why we felt it critical that our forum continues and is informed by you as the participants. Please raise up issues that you are hearing and experiencing and are concerned about or need more information to support the work that you do in systems and in programs. We will engage parents and family childcare and childcare providers, school and community voices, researchers, and health and policy as we move through these school-age forums. It is critically important for schools and childcare to work with families and include them in decision-making. In the end, it's our role to be in service to children and families with the best information and science at hand. We are incorporating our deep history of relationship-based practices into our data-driven approach to this work. So for example, you'll hear today, and I'm sure in forums to come, we know that we are stronger when we bring individuals and organizations together as a team working towards a common goal. Let's take the time to build relationships where they are missing and strengthen relationships to make them more robust. We learn from families if we listen to families. Using data and policy information, we're learning what families need so we can design a comprehensive solution for all families. And we aim to create a holistic picture by lifting up the voice of parents with those of all entities who work in the childcare and education arenas. We can be certain of this: no childcare means no recovery. The pandemic has highlighted the need for seamless coordination among us, and there isn't a better time than now to work together to re-envision the system to lay the foundation for recovery. Regardless of what our role is, we have to ask ourselves, how are we supporting the programs and practices and services and infrastructure needed at this time? How are we raising up solutions in our own organizations, in our own communities, and how are we funding it? How are we equipping childcare providers specifically with their equipment resource needs, training and technical assistance, and supports with spaces and services like social emotional supports for children, tutoring and academic supports, nutrition, and other essential needs that children and families have? Today's conversation is about raising up the importance of relationships and the inclusion of children and families in decision-making. We're at a juncture where we have the opportunity to re-envision the childcare system. We must also address the inherent inequities within programs and communities. Equity has to be at the forefront of the conversation that guides our actions and decision-making. Are we asking ourselves at every turn, are we addressing this value of equity? We have lots to learn from each other for sure, and many more discussions to have. I encourage you to enter the conversation with a spirit of learning and sharing so that we can work together to create safe learning settings to design a system that authentically addresses what children and families need to thrive. We truly are all in this together, and I'm so grateful that we have a community of individuals who are so incredibly committed to this work across the country. So now I'd like to introduce the first of some of those individuals on our panel, Dr. Gracie Branch, who's the Associate Executive Director for Professional Learning at the National Association of Elementary School Principals. Dr. Branch.
Thank you, Dr. Fraga. I really appreciate the opportunity to be here today. Welcome, everyone. I want to give a brief overview of the National Association of Elementary School Principals. This is our mission. So basically, you can see that we are an association that advocates and supports elementary principals, middle level principals, and of course, other educational leaders. Next. This is our leadership team. I want to start with our executive director, Dr. Earl Franks. I'm the Associate Executive Director for Professional Learning. And also you will see Dr. Kaylin Tucker, who's our Associate Executive Director for Communications and also the Editor-in-Chief of our Principal magazine. We also have two more important directors on our team. Next slide. We have Jackie McGrail, who's our Executive Director for Membership, and Danny Carlson, who is our Executive Director for Policy and Advocacy, which plays a big part in what NASP does for principals. So next. So we were founded in 1921, and that's important because next year will be our 100-year anniversary, and we will be celebrating that big time at NASP. So I mentioned that we are an advocate for principals in policy, especially at the federal level. We support continual growth and development for principals through providing quality professional learning and the most up-to-date research and resources for principals. And we also help design activities for principals to learn about being a part of a learning community. And I think one of our greatest strengths at NASP is that we have such a large network, not only nationally, but we also have members in international schools. Next. So in my department, we are responsible for expanding and strengthening professional learning initiatives. And we have tried to be very, very responsive during this challenging time of COVID-19. And I'll talk a little bit more about the resources we provided during this time. Next. So some of the professional learning that is currently going on at NASP, we provide mentoring training for principals and school districts. We have a K-3 Leadership Academy that focuses on the early childhood skills that principals need that are leading those kind of communities in their school districts. We also started last year in cooperation with the School Superintendents Association, a National Aspiring Principals Academy for educators that are looking to go into administration and want to have the skills that they need when they get there. We make it a point of trying to provide professional learning for principals no matter where they are in their career. Next. So one of the initiatives we started last year was the Center for Innovative Leadership. It is manned by two fellows, Dr. Andy Jacks and Hamish Brewer. They have, they're two practicing principals, but also are very known nationally. We're also taking this model of having a center with fellows, and we'll be expanding it next year. So that will be an upcoming news announcement for NASP that will be starting some additional centers that we think will provide some very relevant services to our membership. Next. I also wanted to show the many different ways that we communicate with our members. It's part of membership benefits that they receive from NASP. The last couple of years, we've tried to really have a strong presence on social media. The webinars that we put out are also posted online and recorded so that they're always there for our members. Next. And here just gives a brief kind of sampling of the types of series that we do. Like I mentioned, we try to provide resources for principals wherever they are in their career, early career, assistant principals, aspiring, and of course, veteran principals. We also started several new webinar series in response to COVID-19 that we called We've always been about leading learning communities. So now we had a specialty series, how do you lead virtual learning communities? And how do you principal in place? And we also had a real-time call in, ask questions with our series Live at 5 that we also did in partnership with AASA. Next. So all of our professional learning always culminates in our national conference. It will be in Chicago next year. Unfortunately, we canceled it for this year, but next year, like I mentioned, we will be celebrating 100 years of leadership at NAESP. Next. So as Dr. Frege mentioned, I think partnerships and collaborations are more important now than they ever have been before. These are some of the associations that NASP partners with. And for example, just in getting prepared for today, I reached out to the P3 Center at the University of Colorado at Denver, and my good friend Deb Bergeron, who's the executive director of Head Start, to get some of their input and resources and what they thought about some of the questions we'll be trying to tackle today. Next. So as I mentioned, one of the strengths of NASP is that we have a network of principals. So in response to the challenges of COVID-19 and also the challenges that we've experienced as a nation this year with looking at equity and diversity, NASP began a national COVID-19 task force that was made up of a group of principals all over the United States that could give us input on what principals really were asking and needing so that we could provide the appropriate resources. As I mentioned before, we had specialty webinar series that we started. We were able to get webinars up in a matter of a few days to help our members. We've also started an NASP National Task Force for Race and Equity and continue to look at better ways to communicate, provide resources, and continually survey our members. So I want to talk about, in the next two slides, some recent preliminary results that have come back through the surveys. These results aren't finalized because the survey was still open through yesterday, but I wanted to let you know what principals are thinking about the current situation and what I'm hearing about how districts are planning to reopen. And basically, we know that one size does not fit all, that reopening plans are going to be very dependent on what's going on and the needs of that individual school district and the patrons that reside in those boundaries. So there is no one size fits all model. And most school districts that I know of are going to be providing a hybrid model. And we'll talk a little bit more about that. But when you ask principals if how they're feeling about returning to school, if they would come back the way they always have with the normal day schedule, 5 days per week, we found that almost 75% of the principals were not comfortable or were only somewhat comfortable at doing that. And when we talk about the best model, most are going to provide a hybrid model of remote learning with separate days. Students may be split into two groups. One group might attend school on certain days, another group on other days. Students will participate in remote learning when they're not, when they're at home. So really, a district, I just looked at their model today, has 3 different options for parents, and every district should be, and hopefully is serving their parents so that they can provide them with the best options. When principals were asked about phased reopening, not so crazy about that, only 44% yes, but we've got 33% no and 22% unsure. So they're ready. I think they're ready to be back in school. They would love to be face-to-face, but they do realize that school is going to look differently this year than it ever has. Next. And just a few more insights. How concerned are they about safety, especially with their staff and their school members? 72% are very concerned and concerned. How likely is it that they can successfully protect students and staff from any transmission? You see that 78% were at the lowest. Like, I am really, really, really concerned about this. I just know I'm not going to be able to keep everybody 100% clear of not getting anything. Can they arrange their instructional space for social distancing? 69% are saying that's going to be really, really challenging and difficult for us. And minimizing hallway congregation or any of those common areas, traffic in the common areas, 62% are very concerned about that. When you ask them how important are the following about cleaning and disinfecting, extremely important, 86%. Providing personal equipment, extremely important, 75%. And really, what we really want people to know is that they need to receive funding from Congress. That almost 95% say that's extremely important and important if they're going to provide the materials, the resources, the sanitation to keep their school buildings and districts as safe as they can possibly be. So just in conclusion, for the next slide, I would say that I just want to echo again what you're hearing, that it's going to take us all working together because we're all in this together. And I know that I'd be happy if anybody reached out to NAESP to connect you with any resources that we have. I'm going to be sharing some that will go out in the email that follows, and just appreciate the opportunity to let you know what's going on in principals' minds, and that NAESP is here to help in any way that we can. Thank you. And I'd like to introduce Dr. Heidi Rosenberg. Thank you.
Thanks, Dr. Branch. And thank you too to Child Care Aware of America for hosting this very important conversation. So I am Heidi Rosenberg. I'm the Director of Research for the National Center on After School and Summer Enrichment, known as NCASE. Next, please. So NCASE is a national training and technical assistance center funded by the Federal Office of Child Care within the Administration for Children and Families in the Department of Health and Human Services. So the Office of Child Care administers the Child Care and Development Fund, known as CCDF, which is a block grant to state, territory, and tribal governments that provides support for children and their families with paying for child care that will fit the needs of their parents' work schedules and prepare children to succeed in school. The CCDF is the primary federal funding source for child care subsidies to help eligible low-income working families access child care, as well as to improve the quality of child care for all children. CCDF subsidies serve children from birth through age 12. At NCASE, we focus on school-age children, those ages 5 through 12, so roughly kindergarten through early middle school. So these subsidies can be used for before and after school care, care during school vacation breaks or holidays, and summertime child care, all of which are part of the broader out-of-school time landscape. So in our work, we support the state CCDF lead agencies who administer the child care block grant program at the state level. The families that we focus on need child care that addresses the needs of their work, education, or job training schedules. And for these families, access to after-school and summer child care both benefits their children's learning and development and serves as a critical facilitator of their workforce participation. Next, please. Now, one of NCASE's ongoing tasks is to gather information on how many school-age children are served through subsidies and where they're served, as well as track information on state policies and practices that can promote access to school-age childcare. One of our ongoing resources that we update each year is a set of data profiles. And our newest data profiles use the fiscal year 2018 data, which is the most recent ACF or CCDF data that's available. They're in the process of being finalized and will soon be posted to the website you see here. So in fiscal year 2018, an average of 584,000 school-age children were served through subsidies each month. Roughly 3/4 of those children were served in centers, with slightly under 1/4 served in family child care programs, and the remaining children were served in their own homes. And I just want to note that because the most recent CCDF enrollment data are from fiscal year 2018, we don't yet know what the numbers are going to look like for this year given the school and childcare closures, but we will be tracking that. So what you don't see on this slide, but you will see when you get to the profiles themselves, is we also provide information on things like the consumer education websites and the data that parents can parse to find childcare that suits the needs for school-age children. And we also show which states have training and technical assistance requirements around supporting the positive development of school-age children, and which states utilize grants and contracts as a way to promote access to childcare. So I encourage you to check out the profiles and look at what your state reveals. Next slide, please. So in addition to supporting CCDF lead agencies in their work serving children and families, another goal of NCASE is to promote collaboration between CCDF lead agencies and other statewide entities involved with school-age children, such as state education agencies, the 21st Century Community Learning Centers program, statewide after-school networks, National After-School Association state affiliates, and other school-age stakeholders. So this collaboration is particularly important as states plan for a combination of in-school and remote learning contingencies for the coming year. So these plans all have implications for school-age children's access to OST programming for enrichment, as well as for coverage during regular after-school hours and during any days when children may not be able to attend school in person. So as child care agencies and state education agencies formulate guidance for around reopening plans for programs in schools, it's really critical for these agencies to think about how that guidance affects programs serving school-age children, which often sit at the intersection of child care and school functioning, especially given the number of before and after school programs that are located at schools. So NCASE is working to track schools, state school, and child care reopening plans, though we recognize that those plans are constantly in flux given the evolution of COVID case numbers and other reopening data. Next slide, please. So I'd like to highlight some of NCASE's resources that could be particularly helpful to state agencies and providers as they plan around reopening and navigate the complexities of operating during this particular time. So we know that OST programs have always placed a strong emphasis on supporting children's social and emotional learning, and this focus will be critically important as schools and programs reopen and welcome children back. So this bundled set of resources that you see here focuses on how OST programs can promote social emotional learning and wellness among school-age children, and there's a variety of different resource types that you can use in your own work. Next slide, please. We also know that the school and childcare closures and the effects of the overall pandemic are having an adverse impact on many children, particularly those who were already vulnerable. So when schools and programs reopen, it will be very important for staff to recognize these effects and adopt a trauma-informed lens in their work with children and families. So this bundle of resources includes research briefs, a webinar, and a professional development module, all related to trauma-informed practice and adverse childhood experiences. Next slide, please. And then in a typical year, we know that the transition to kindergarten and out-of-school time care represents a really pivotal time for children and families. And this particular year, this transition is going to be even more complex as children and families navigate school environments and schedules that have to be modified because of the pandemic. So this set of resources frames the transition to kindergarten through a broader lens that includes before and after school care needs, the different things that families may need to consider and think about as they make choices about after school plans. So in this particular context, it provides a lot of prompts that are still relevant as families think about what choices they may be making and what options are available to them to meet the needs of their children as well as their own work coverage needs. Next slide, please. And then finally, we have an emergency preparedness and response toolkit. So emergencies of all types, including virus outbreaks, can occur abruptly, as we know, and cause devastation to programs, families, communities, and entire towns and cities. So this COVID-19 pandemic and the resultant school and child care closures and the impact on children's and families' health and well-being is an emergency that's impacted our entire country and in fact, the world. So the purpose of this EPRR toolkit, which includes information on infectious diseases, is to assist OST leaders and staff in developing emergency preparedness plans that address the distinct needs of out-of-school time and childcare programs. So as schools and programs prepare to reopen while also thinking ahead to the possibility of additional closures in the coming year, this toolkit can help staff be prepared and respond accordingly to maintain the health and safety of everyone. So next slide, please. In addition to the resources that we just highlighted, we have a number of additional resources in our resource library. And so we encourage you to please look through the topics that we have there to see what might be helpful for your own work. And with that, I will turn things over to Dr. Dion Dobbins.
Thank you so much, Dr. Rosenberg. I'm really excited to hear more and to see the work that you guys are doing around your data and the new profile that you'll be putting out. So I'll be looking forward to hearing about that. My name is Dion Dobbins, and I am the Senior Director of Research here at Child Care Away of America. And I'll be talking with you about the child care school age data that we collect and the considerations and the challenges that we've had around collecting school age child care. Next slide, please. So a little bit before I do that is really wanted to talk with you all about the realities of COVID-19 and school age care and just sort of set the stage. And I know I'm preaching to the choir when I talk to you about this, but there are a lot of things that we'll need to think about and how this is going to affect parents and families and children and providers. And I want to say, and I want to believe that data can be the driver to help us understand what is needed for these families and children. But parents are going to need to cobble together a variety of childcare options to meet their needs. Depending upon the type of program, the type of school setting that your child will be in. Will you be home? Will you be in one of the hybrid situations? Will you have children of different age groups in different schools who may need to, and you may need to figure out as a parent what your different schedules are. That's where I am right now. Working parents will need to coordinate their schedules with both employers and with schools to really make sure that their children are being cared for during times where there is no in-time school. Providers will need to be flexible. Can they meet the needs of parents who have multiple children or who have crazy schedules? How can we ensure that they have the information that they need and the desires that the parents have for care? And really, one of the things I've been truly thinking about is that the meaning of non-standard hour care will really be changing dramatically. What will that mean? It's going to mean 24-hour access for many families and many providers, really thinking about how they coordinate, how they ensure that they're meeting the needs of parents as well as the groupings and the space size and the amount of children that they can serve during different times of the day, depending upon the schedules that parents and children are going to have. Next slide, please. So at Child Care Away of America, we collect data annually from 50 states around the child care landscape. And we have data partners across the country who provide us information on access, supply and demand, price, quality, referral information, and frankly, the availability and sometimes reliability and cleanliness of the school age care data have proven difficult to get. And it's not because it's not there, it's just different states are doing different things, collecting it in different ways, and it's sometimes very hard to get aggregate data or to get similar pieces of data to compare across states. So I wanted to sort of talk with you about some of the challenges that we've had as an organization in really reporting and understanding that school age care data. So if we can turn to the next slide, please. So in general, I would say we need better school age care data. For our part, when we're working with our data contacts in every state, some aren't collecting data on school age childcare or aren't able to give us all of the different pieces of data that we have on school age childcare. So for instance, we often, I feel very comfortable about the information that we receive from our data contacts around referrals from parents who need school age care, but not necessarily as comfortable about getting data around price. Because we have to calculate that information based on hours and based on full-time versus part-time. And they're not always collecting the time that children are spending in those settings where they're spending it as well. Another thing that we're realizing is that they're not always using standardized definitions of school-age childcare. Some are, and we're also very interested in not just childcare, and a lot of our states are not able to give us data from other funding sources. And that kind of takes me to the next step. Next part is that school-age childcare, as you know, can take place in many different types of settings at different hours of the day, and it's hard to get sort of these aggregate numbers. You know, just in general, some states can give us after school data, and then some can give us before school data. Others can give us summer camp data. Some can give us child care program data that talks about the children who are being served after, you know, during non-school hours. Some states have data on the hours that they're serving these children, and some don't. And then when we're, as I mentioned, we're trying to get some of the school-age childcare data, it's not always available, and calculating that information can be challenging. And then a few states are able to give us school-age data by age, so like the slots that are available for school-age children, or by setting. And so they may be able to give us the number of school-age children that they are, or the number of school-age programs, but like the actual slots and where they're being held, where they're being served, is not always easy for the states to share with us. And it really just depends on the data systems that they're using, the way they're defining information, the way we're asking information. So we know also that we need to think a little bit more strategically about the data that the questions that we ask as well. Next slide, please. So in general, and this is for all of our data, and especially in the childcare space, but I think in particular, we would love to be better with the school-age care data. We need standardization, more common definitions, and data governance in order for organizations like ours to get this data and be able to talk about aggregate information, compare across states, and to really say what we know about the childcare landscape as it reflects school-age care. So, you know, some of the things that we've been thinking about are maybe including more specifics around the definitions of school-age care that when we're collecting data, really thinking through, maybe working with some of the partners who've been on the call today to help us think about the better ways to ask questions about school-age care data. One of the things that we've been talking about internally is thinking about asking for, in addition to asking all the questions that we have, really pinpointing and asking for data about school-age care only programs, because a lot of times, especially when we're dealing with childcare, they may have slots in a larger program or in a family childcare based home program, but really trying to get at programs where they're only school age. And then we really understand the importance of getting data from different types of programs. And I think for the most part, we have been focused on the childcare arena. And so really thinking about the different funding streams, the importance of collaboration and coordination. I loved what Dr. Rosenberg was talking about in terms of how they're doing a lot of coordination with the Department of Ed and other organizations that are serving children. Really thinking critically about who we can reach out to create data sharing agreements and building interoperable data systems so that we can really understand all the different players in school-age care and get good data from childcare, education, and the enrichment programs. And I think we're really, one of our ultimate goals is to be able to track children in school-age care by age group and by setting, where they're served, understanding how long they're in care, and to really get a better way of understanding and calculating the cost and price of childcare. So I am going to turn it over now to Heidi Ham from the National Afterschool Association. Thank you.
Thanks, Dion. And thank you to Child Care Aware for hosting this forum and the opportunity for us to learn and share alongside such esteemed colleagues. Hi, everybody, all the participants. My name is Heidi Ham, and I'm the VP of Programs and Strategy with the National Afterschool Association. To provide some context, I'd like to tell you a little bit about NAA next. At NAA, we believe that when adults invest quality time and compassion in young people, that our youth rise to the challenge of making the world a better place for themselves and for others. And we believe that the passionate people in the after-school profession, including those who work in school-age childcare, are part of a learning and development ecosystem that is key to building our future and the future for millions of kids. We believe that after-school and summer programs make a difference in the lives of young people, our communities, and our nation. And we believe in creating an even more equitable, collaborative, and powerful learning and development ecosystem, and look forward to working with you and others to make it so. And we know that time to make it so is now. And the time is now for so many reasons. Next. But for the purpose of today's conversation, the time is now because there really is no economic recovery without school-age childcare and out-of-school time programs. Why? Because kids, families, and communities, including schools, need us. Next. High quality after school and summer programs provide safe and enriching places for kids to go while their families are at work. They provide schools and communities with additional support, and they give kids an opportunity to explore interests and build important social and emotional skills. Research shows that knowledgeable and competent staff provide the high quality programs and experiences that result in positive outcomes benefiting kids, families, schools, and communities. Next. That's why NAA, who is the National Professional Membership Association for people who work with and on behalf of youth during out of school time, develops and advocates for those after school professionals and leaders who are the after school workforce. At NAA, we use our purpose, position, and partnerships to focus on building equity and connections through convenings, content communications, and capacity building. And we do it in 4 strategic areas that strengthen the workforce, the profession, and experiences for kids. Next. The first strategic area includes creating, contributing to, and promoting professional and program standards, fostering partnerships and policies that support the development of people who work to provide high quality after school opportunities for kids. Next. The second area is geared toward developing after school professionals and leaders. Next. Third, recognizing and promoting the important contribution of the after school profession and its professionals. Next. And the last strategic area focuses on creating community, networking, and knowledge exchange among after school professionals, leaders, and other key stakeholders. NAA currently serves a membership of 35,000 after school professionals and leaders. All of our work is done in service of members and frequently in collaboration with them and in partnership with our 32 state affiliates, as well as other organizations like those in this forum who share a mutual purpose. Our recent offerings include resources and opportunities for connection related to 2 timely topics. The first, anti-racism and equity, and the second, operating virtually or in person during the pandemic, including partnering on school reopening plans. If you'd like to hear more or learn more about NAA, its state affiliates, and the available resources, you should visit our website at www.naaweb.org. At NAA, we believe that successful school opening plans will be developed jointly by schools, parents, teachers, after-school programs, and community-based organizations, who together can ensure that kids are safe and building academic, social, and emotional, and other skills during the hours their parents are at work. This would be an example of a collaborative learning and development ecosystem at work to benefit all. Now it's my pleasure to turn it over to Heidi Brasher from the YMCA of the USA.
Thank you so much, Heidi. I appreciate it. And again, want to thank our colleagues across the country who have joined us today, many of whom we partner with daily to serve our communities and our families. I want to tell you a little bit about the YMCA as a way of start. In the US, we have a YMCA of the USA, which I am a part of, which is our national resource office. and then more than 2,700 YMCAs throughout 10,000 communities, serving through 19,000 full-time staff and over 600,000 volunteers. So a very wide reach. As the largest nonprofit provider of childcare, we serve more than 8 million youth under the age of 18 in a traditional year. And we do that through before and after school care programs, infant care, and preschool care. Next. I want to share with you a little bit about our response as an organization during this pandemic and just set the stage for some of our learnings that have come out of this time. As states and communities and cities across the country closed and began to shelter at home or shelter in place, the YMCA followed suit. Our business as usual transitioned into two primary emergency areas, the first one being our emergency food programs, and the second one being our emergency childcare programs. In our food serving space, that is something that we do daily, traditionally, but during this time, more than 800 YMCAs and 1,000 affiliated sites really stepped up to do food distribution through meals, through grab-and-go meals, through partnering with our school districts, and really taking advantage of all the USDA waivers that were being released during this time. We saw a new set of hungry coming to the YMCA. People that had never come to the YMCA for our food programs before found us as a safe place in their community during this really challenging time and joined us in this work. The second space for us was emergency childcare. Again, as the largest provider of nonprofit childcare in the country, this is our wheelhouse. But during this time, we really had to transition our services and what we provided in a safe space. In doing so, we offered more than 1,100 sites of emergency childcare, beginning with service to families of our first responders, medical professionals, really essential employees in the community. And as we've moved into the summer months, that has transitioned into more and more parents who are able to go back to work as our cities and our communities are starting to reemerge. We know that safe and affordable and reliable childcare is essential to our economy. We've heard many of our partners today speak about that. Next, please. I wanted to share with you some of our top lessons learned during this emergency childcare response, some of the lessons that we carried into our summer response, and some of these lessons will carry into our response for what will happen in the fall. We had three top lessons that we've learned. The first one is really around creating a culture of safety. How did we take our current childcare programs and make them safe during this pandemic time? From the use of PPEs, to social distancing, to our cleaning and our sanitation procedures. How did we serve meals? Moving from congregate meal service really into small cohorts of children and mealtime. We made sure that our emergency childcare sites were closed sites in terms of who were able to visit those sites. Parents did drop off at the front of our facilities as opposed to coming into our facilities, really limiting those that were in contact with our students and with our staff, and creating that culture of safety for our participants as well. What were we teaching our youth during this time in terms of hand washing and social distancing and wearing of masks? All very important things for us as an organization, creating this culture of safety. The second big learning that we had was around our cohort distancing, creating small pods, small family groups that really went through our emergency childcare operations as a family unit. They stayed together throughout the day. They stayed with the staff person in charge of those groups. They made sure they were social distancing within those cohorts. So the ability to really know who was in contact with our youth and our participants at all times was vital to increasing, again, that culture of safety that we were working through. And then a big learning for us, and I think we've seen it across the country, is the fact that all of our measures in safety and distancing are able to reduce any opportunity for positive cases, but they were not a prevention for any positive cases. We were truly blessed as an organization because of the great work of our local staff to have a very low incidences of any type of positive case during this time. Again, it was reduction of, not prevention of. And we know that moving forward, that will be very important as we think about what the fall looks like. And some of these lessons learned, again, we will carry into our response as an organization for the fall. Next slide, please. I wanted to show you a little bit about how we're thinking of as an organization. We heard a lot about collaboration today. We heard a lot about working together, how we need to all come together as providers and agencies for this continuum of care for our youth. Our school districts are important, our principals, all of our providers. And so we've taken this for many of those on the call today in some of their great tools and resources, but we are planning as an organization to be able to respond in 3 primary models. We know there might be a virtual model where all learning happens 100% virtually online for all grades or maybe certain grades in our school districts. We know that some of our schools will try to get back open in a more traditional offering, where they'll have maybe certain grades coming and others still being at home, but still some traditional type of school presence. And we know that some of our schools will do hybrid models, where, as you saw Gracie present in some of the data earlier on in this conversation, many of our schools are looking at this hybrid model, either split schedules or opportunities for different grades or time starts. And so we as childcare providers need to be flexible and nimble and able to respond to each of these models. I've listed here some of the challenges that we know in conversations with our great partners at school districts that they're facing. Some of the data, again, that Gracie shared is reiterated here. And then some considerations for us as a childcare provider that we need to look into. How are we reaching students without internet access? How are we really creating equitable learning environments? And we know that the digital divide is ever increasing. How are we addressing that as an organization and as a community? How are we able to provide additional supports for teachers during this time and helping to equip teachers as well? They are our partners in this space. In traditional models, we know everything that we learned in emergency childcare will continue. Increased sanitation, use of PPEs, smaller sizes, smaller ratios, smaller classroom sizes, limitation of space is all going to be an issue as we move into the fall. And so how are we working with our schools and our school districts and other providers, again, to ensure that we can support in a traditional model? And then in a hybrid model, again, many variations, probably as many variations as school districts will be what we see. How do we provide care, all day care when they're not in school or potentially after school hours? And Deanne, I think you said it really well, that change in hours will be seen much more and more in this space, in this industry as we move forward. And as providers, we need to remain flexible and step up as partners for our school district and be able to respond in the ways that they need, knowing that could change throughout the school year. We might start in one model, have to shift to another model, move out of a model. And so really walking alongside as a true partner really will be what makes us as an industry step up in this time in the fall. Next slide, please. Just wanted to share with you, and again, we'll share some of these resources post-forum today, but you can see the continuum here from left to right on your screen. We started with these really quick start emergency childcare response guidelines, and thanks to in part to the CDC and some other really great partners. Moved ahead into the summer about planning ahead, thinking about what the fall looks like. And now on the right-hand side of your screen, starting to really navigate and think about scenario planning and what does that really true out of school time space look like for us as an industry and as an organization when it's no longer just those after school hours, but it could be any times of the day. Deanne said 24 hours a day, and we do anticipate some of that. So helping our local YMCAs navigate through all of this space, having partners walk alongside with us, give us their tools and resources, getting that out to all of those local YMCAs that I talked about at the top of this conversation in more than 10,000 communities across the country. And how do we really become a part of that continuum of care with providers like ours, with our school districts, with our government agencies, with our local communities as well. That's what we're focusing on as a YMCA. There are no easy answers. Dr. Fraga, you said it great at the beginning. There are no easy answers, but if we can come together as an industry with partners and providers and parents, we're hearing a lot from our parents about the stress of this time, competing information coming in for them, and so much of it being placed on their shoulders to make the decision on what's best for their youth this fall. So how can we support in all that space? And that's what we're looking to do as an organization. We're grateful to be a part of these conversations and to have the partners that we do that have allowed us to serve during this time and into the fall. It's my great pleasure now to turn it over to another partner of ours in the food space, in the food program space. So Alexia Fex, I turn it right over to you.
Thank you so much. Let me make sure you can see me. Thank you, Heidi. I appreciate it. Hi, everyone. My name is Alexia Fex. I'm the Partnerships Manager for National CACFP Sponsors Association, commonly known as NCA. Next. Our number one goal, today you've heard from a variety of people supporting childcare and out of school time programs. And our number one mission is to make sure that whether you are open or closed, that we can help support you serving meals to all the children nationwide. We are the national platform for child and adult care the food program. Our main goals is to provide nutrition education. We offer a CACFP certification program, and we do a number of advocacy initiatives for both sponsoring organizations and providers. Next. I'm speaking to the choir probably, as many of you know, care and out of school time is in flux as we kind of move towards fall 2020. I just wanted to share some resources that we have to help you navigate in the meal space. As many of you are probably aware, USDA did initiate some federal waivers, and some of those have been extended. So things in relations to the meal pattern requirement, being able to serve outside of group settings, parent pickup meals. A couple that have not been extended that we're kind of keeping an eye on is the after school activity waiver and also the monitoring waiver. Those are set to expire or have already expired. If you want to learn more about the waivers, I have the link, and I know that we will be sharing this PowerPoint to the USDA site. And then also remember that the USDA initiates these waivers, but states have to opt in. And so if you want to check to see if your state opted into all the waivers, and if they are currently opting into the waivers, you can click that link below and find that. As I think Dion said best, we don't have hard data of what's going on in the meal space at the moment, but anecdotal evidence. We've heard quite a few, because of the economic state of the nation, we've had quite a few centers and even family home child cares trying to get on the food program. And one of the fastest ways to get on the food program is to find a sponsoring organization. A sponsoring organization can get you on the CACFP program pretty quick and can provide training for you. So if you want to find a sponsor in your state, you can click on that link when you get this PowerPoint. And I would also say that if you are a center and you prefer to basically contract with the state yourself, you can also start with a sponsoring organization. They can get you up and running and then transition to the state. And the other thing we're hearing quite a bit is the, obviously, a lot of grab and go meals, a lot of non-congregate feeding meals and different food products. If you are looking for either caterers or different food service options, you can visit our buyer's guide on our website. in order to try to find meal service. You know, like I said before, we're here to basically make sure you're trying to feed kids, whether you're open or closed. Whatever we can do to support you, please, you know, reach out to us. Next. On our website, which is www.cacfp.org, you will find a number of resources to help support the meal programs. We have recipes, menus, cycle menus, you know, basically anything for your child cares, some compliance program handouts. We're actually doing a virtual summit in August for providers and sponsors to get some training in. And then, you know, it's always nice to have motivational posters because you guys are doing such a great job, and those are also downloadable as well. This doesn't include all of our resources, but it's a good example of what we have available to you. And like I said, we are here to help you continue to get those meals to those kids. And thanks for all you guys have done. Now I'm going to turn it back over to Kiami and see if you guys have some great questions for us.
Thank you so much. We do have quite a bit of questions in the Q&A, but before we do that, I'm going to turn it over to you, Jennifer, to share questions. If you have additional questions for us, please make sure you use the questions box. I know a lot of you have been using them already, and we see them, and we'll try to get to as many as we can. Jennifer?
Sure. Gosh, thanks so much to the panel for all that great information. We are seeing and hearing a lot about reopening plans and a lot of different types of arrangements, as Dr. Branch described. We're not seeing childcare, or frankly, families' comprehensive needs for childcare during e-learning hours or out of school time mentioned in most of those plans. And a question for the panel and for participants who are free to chat in as well: how can we ensure that moving forward, childcare and families have a stronger voice in these conversations so that their comprehensive needs for learning and care are met? Now I'll ask the panelists to turn on their cameras if they'd like to respond. Dr. Rosenberg.
Hi, thank you. So one thing that I wanted to follow up on, I know that Heidi Ham had mentioned this in her comment, but this COVID crisis has really demonstrated this critical relationship between out-of-school time care and parents' ability to work. So for many working parents, the loss of before and after school care, and now summer care in many cases, which still remain closed, in many cases were just as disruptive as the loss of school in terms of the impact on their work. You know, many parents don't have the flexibility to be able to do their work from home, work remotely. You know, those who work in essential services, those who work in like the service or retail sectors. So for those parents, that loss of childcare and coverage is really devastating in terms of their workforce participation. So, you know, in this way, we're really seeing how closely intertwined childcare and out-of-school time programming is, and how incredibly necessary both are. I know others have mentioned too that reopening the economy doesn't happen unless you reopen schools and childcare in some fashion. So we're really seeing that hit home. So one thing that we just wanted to mention is how important family voice is, and, you know, to the extent possible, you know, whatever reopening groups there are around school and childcare reopening, to try to find a way to tap into parents' voices through surveys, focus groups, whatever way they have to contact them, to find out what would some of these different scenarios that are being discussed have implications for their ability to work. And, you know, this is a really critical piece, because it's not just about preferences or, you know, what might be ideal for children, but there's also that critical piece of what's going to enable parents to have economic security by being able to be in that workforce. So, you know, to the extent that people involved in reopening conversations are able to tap into that parent voice by reaching out and engaging them, will be really, really critical.
Thank you.
I would just like to add that I think that, as principals, we don't know what we don't know. And so if I had patrons in my school district that needed help with childcare, I would want to know. And so I just think that, hopefully districts are being proactive and doing the focus groups and surveys, but if not, I would urge families that have special needs in this area to reach out to their school superintendent, reach out to their elementary or school principal, and let them know that they need help and support. So I think it's going to have to take proactiveness on both sides. But sometimes we just can't assume that school personnel know all the varied needs in their school district. So I just want families to know that they have a voice and that we want to hear from them.
That's so important. Thanks for sharing that.
I can add on to what's already been said by Heidi and Gracie. So to your comment about school reopening plans, Jennifer, I just wanted to say there is an analysis of state school reopening plans, and that analysis it's an ongoing analysis from Johns Hopkins University. It shows that 44 out of 53 plans do include before and after school programs, but of course this is to varying degrees. So in some states, it's merely mentioned, saying that childcare should be considered, or in some states, it's saying that childcare is recommended and districts will work with organizations and agencies to ensure childcare options are provided. So to the original question about what we can do to be included, the first, and this is one of many times that you'll hear me say relationships, along with the other folks saying that relationships are important, but building relationships and speaking up and to voice your needs either as a provider or as a parent to school leaders, to community leaders and public officials, so that they are so that your voice is always included in the important related planning conversations. Collaboration is a way for us to work together to the mutual purpose of what's best for kids and families and communities. And if we reiterate that to the leaders, then I think they'll be more likely to engage with us. And then we're always encouraging providers to think creatively, and you saw some of that in Heidi Brasher's presentation from the YMCA and what they've done to be creative. And we want to make sure that providers remain mission aligned so that they don't go so far off base that they're not doing what they're proposing to do, but also thinking creatively and then bringing, like Gracie said, bringing solutions to the table. We have resources to support the efforts, and we'll make sure some of those links are in the resources from the forum follow-up. And just kind of, so those are really tactical things that can be done, but I really think it's necessary to call out that we know that inequities exist. They've been more visible and exacerbated by COVID-19, but they have existed for hundreds of years and they are systematic. So when it comes to longer term things, we need to think about how to efficiently and equitably meet these needs through inclusive, comprehensive learning and development systems. So if we can all, as educators and people that care about kids and families, can think about the science of learning and development that has implications for kids across all of the settings where where they live, where they learn, and where they play. If we can use that to drive systems that impact young people and communities everywhere, then when communities have this comprehensive, well-coordinated approach to learning and development that's inclusive of all these settings and all the adults and kids that are part of them, there will already be a mechanism in place that can be activated to respond to unplanned events like a pandemic.
Thanks.
Hi, Jennifer. This is Lynette. I'm just going to jump in. I won't turn on my camera so as not to take more time, but I just wanted to jump in really quickly and raise up and thank you all so much for your terrific responses. how critical child care resource and referral agencies are in bridging these relationships as well. And as we talk about, Heidi, you're speaking to the science and what we know about the development of young children and the knowledge about what's happening on the ground and supporting family child care in center-based settings, the understanding of communities and schools, and the strength of relationships there. I just wanted to ensure I amplified child care resource and referral agencies who do span and bridge all of those areas. And I really do hope for those on the phone that either are or are connected to child care resource and referral agencies. I think that's a real opportunity for us to amplify the necessity of all that you all are talking about at the local and the state level, so that we can be more deliberate in how we're making those connections across data and relationship and what we know is important about engaging family voice, as well as the data that drives our decision making for effective policies and communities around these issues. So, so thanks. I just wanted to add that.
Thank you. Kiami, what are you seeing in the question box?
So we have a couple of questions, and one in particular is for Gracie, and it says, since many school-age child care and after-school programs are housed in schools, what information do you have about willingness of principals and schools to create space for these services?
You know, in all of the school plans, and this was mentioned earlier, I think schools are just now getting to the place where they're thinking about those issues, because a lot of school districts that I know of personally have just released their back to school plans this week. And so I don't have any specific examples of how school districts are developing that, but I see that in the queue, and that will be something that will be forthcoming. And as I receive any information or resources about that, I'll be sure and share those with the panelists today.
Sure,
So I'm
thank you.
sorry I don't have more specific information about that, but I know that plans are just now getting out to the community. And transportation, that really hasn't been mentioned very much today, but transportation can be a big issue and a part of that too, that school districts have to work out.
Thank you. Kiami, did you have another question?
Yes. So as states allocating child care, they want to know, are states allocating child care funds for school-age children to go to daycare full-time versus going to on-campus school? I know some child care centers are offering to help with virtual learning if parents can pay.
Would anyone like to speak to that?
I think from a provider perspective, maybe it's the answer is potentially yes. There are options, and there are some options on the horizon. Navigating those across states and in counties proved to be difficult and challenging, and that is one of the areas. We have an amazing policy and advocacy office. They're actually on the line with us today, but they help our local YMCAs based on state navigate some of that. And they are up to date on the latest of what's coming out in terms of funding and where those opportunities are. So short answer, yes, with the caveat that it is not always easy to navigate, I guess is the best I have.
Okay. Thank you. So the pandemic has been an opportunity to spotlight families, child care providers, and CCRNRs resilience and their creativity, and at the same time, as some of you addressed in your comments, many are continuing to experience trauma. What what social supports are needed or being provided? What are you hearing about that?
I'd love to start that one if that's okay with the panel.
Sure.
We hear that need for support in every conversation that we're having. And we actually see it kind of in a three-part series or process for us as an organization. So we know that supports for our staff must be in place primarily. Like, in order for our staff to support the youth in our programs and the youth coming back to programs, we must support our staff. And so the mental health of our staff,
I think we may have lost Heidi for a moment.
So I was kind of yesing her comments already.
ability of our staff for that
Oh, there she
persistence
is.
and grit and perseverance is so necessary. So we're spending the fact that
Heidi Brasher, I'm so sorry, your signal is cutting out and your voice is going in and out. I'm not even sure if she can hear me.
Yami, can you if you mute her, I can kind of jump in because she started to talk about the adults and I can jump in there because I was already giving her the holler back on that. I was in agreement with that.
Yeah,
that
sure,
work?
Heidi, go ahead.
Yeah, okay. So we know that supports for kids and adults, both of those are necessary. And we do a lot of work with Maslow's hierarchy of needs. So the adults are going to be really important. So that hasn't changed. The adults that work with kids, they need to be taken care of so that they can provide what kids need. We need to first provide for their safety, right? So personal security, their employment, their resources, and health. And always we need to be working to ensure those policies and practices from lawmakers and employers, good wages, benefits, including health insurance and paid time off, and also gratitude. So these are things that were broken before. And I think not only, I mean, I can see, Gracie, you nodding your head, but this is not only for after school and school age childcare providers, but I see a lot on the internet about teachers feeling the same way. They're not with all the ambiguity and they feel like their health and safety is at risk and their opinions aren't being taken into consideration, and people are calling them essential and they're calling them heroes, but they're just expecting them. They do great work, but it's not about being a hero. Like, these people are not invincible. So we need to make sure at the very basic level that we're taking care of the adults. And then, so if people are working with kids virtually, and that's what we're expecting them to do, we need funding and access. We need them to have access and funding for the internet, for technology, for training on trauma-informed practices, for virtual facilitation of relationship building and learning, and so much more. And this training needs to be paid. And if we're expecting people to come back to work or provide in-person services, well, we need funding and access to so many things like personal protective equipment, cleaning supplies, support for cleaning, because everyone can't just be the cleaner and the educator. We need support for those things. We need paid training on COVID-19, safety, again, with trauma-informed practices, relationship building, cooperative learning, while physical distancing. And there's so much more to think about to take care of the adults so that they can take care of the kids.
Some school districts are thinking about going back to a 4-day or having a 4-day work week, so that Friday is for that very thing, for them to plan, communicate with families, kind of, have that one day to get everything together. So I think that, one of the things that I heard Christy Cower say from the P3 Center, we've got to be giving people space and grace and a lot of flexibility during this time because it's a new normal. And we've just got to really be open to all the possibilities to try to keep people healthy.
I just want to add one quick thing too, and I really love the focus on the needs of the adults as well as with the kids and the youth who are being served, and that another big core category of adults in that case are the parents. So I know in many cases with childcare and after school programs, it's very common to think of just the child as the core constituent there who's being served, but the effects of the pandemic and the closure, especially for working parents who are the ones utilizing, for the most part, a lot of these programs, trying to juggle having their kids at home and maintaining employment and all of this, have been extraordinarily difficult. And so we're hoping that programs will be able to take that holistic approach to serving both children and their families and their parents, and thinking about what supports can they be offering for mental health supports, social emotional supports for both kids and their parents, and connecting the parents with what they may need so that they can have a healthy home that lower stress. I'm going to say nobody's going to have a stress-free home right now like with this, but a lower stress home and able to navigate that. And one of the other things too that we hear from some programs is that they're really hoping that when they're able to reopen and serve kids, that they'll be able to focus so much on that social emotional foundation of what they do and what they do really well. A lot of kids have spent the last 4 months very isolated, isolated from peers, isolated from other people. And as programs reopen, that connection and that relationship building will be so pivotal, in addition to staff being able to help kids navigate what does it mean to engage with your peers and with other people safely in person in a way that is also meaningful, and to just kind of redefine no, it's not going to look like it did before, but that there are still meaningful ways that we can engage with one another and collaborate and partner together on projects and things like that in a way that's safe. And so I think just helping youth and kids redefine what that means is going to be a core piece of that SEL work and the relationship building work, and reorienting them to the new normal when they come back into the buildings.
Jennifer, I would love to follow up on a comment that Lynette made about the CCR&Rs, and she's right. Many CCR&Rs have stepped up to the plate to support both of these groups, the parents and the providers, and frankly the children too, through indirectly. But we did a survey last month where we surveyed our members, many and the CCR&Rs that are part of our membership, and we reached 163 agencies from 41 states, and we found that from a lot of their responses, they really are critical supports for both families and providers. They're doing a lot. So a couple of quick data points. 67% of them that responded are responding to the emotional needs of families. And they mentioned things like answering their questions, validating their concerns, helping them navigate the tricky systems, and the responding to the questions and customizing their responses based on the needs of their families and the children that they were serving. And another 38% are providing parents with what they're calling consumer education, where they're helping them through pamphlets and webinars like this to understand the complicated policies related to either reopening or cleanliness and PPE. 37% are helping parents secure financial assistance for childcare. And then when you're talking about what CCR&Rs are doing to help providers, a lot of them are really thinking about and helping them think about the financial needs. So at the time when we sent out the survey, 42% of them responded that they're helping child care programs apply for federal assistance, and 37% of them are actually, they're part of that system where they're actually administering the federal funding to providers. And another 23% of them are helping them find financial assistance outside of the federal resources. So they're really helping everyone in this system. They're kind of a critical piece. We talk about them being the eyes and the ears of the child care community, but I think Jennifer was the one who suggested that we maybe even need to broaden that. They're the bones and the skeleton and the muscles and the blood coursing through the veins of child care and really are helping many people in that system. A couple of other things, many of them are really working to do training and technical assistance, and they're poised to begin providing that to programs and to families. They're hearing from parents, they're seeking information on the safety of their environment, how they can pay for care, and where there are openings. So similar to what they hear in regular days. So I think child care resource and referral agencies have always been there to support families, and I think they've stepped up to the plate during this time frame as well. If you're interested in seeing more about that survey, it is available on our website, and we have a really nice infographic that's been developed talking about the different things that CCRNRs are doing for providers and parents, as well as some of the other data that we collected on that survey.
Thank you.
If I can just add one thing about, we really echo the funding piece. As you know, many childcare and after school care is crucial for a vehicle to basically serve meals. And if those programs are not in place, then it definitely is a reduction of meal service. I think we think families are stressed. There are different financial needs now, and they need those meals going to those kids. So, and with increasing food costs, we're really concerned about the ability to serve those meals with all the components. So I just wanted to echo that from the food side.
Thank you, Alexia. And thank you, everyone. Fantastic information and discussion. And thanks for everyone who chatted questions. I will turn it over now to Dr. Fraga for some closing remarks.
I'll make it quick. Firstly, oh my goodness, what an amazing panel. We could have gone on, and fortunately, we're going to have a subsequent forum. So Jennifer will talk a little bit about that. So thank you so much, every one of our panelists, for making today's conversation so wonderful. These kinds of conversations are so essential to ensuring our children are supported in their education and in their school time instruction, as well as school time instruction. And we acknowledge that care time is learning time, right? And vice versa. So we're talking about the whole child and comprehensive supports for children and families. And really so grateful for such amazing expertise today for our participants to hear. Really only making more clear the importance of partnership and shared understanding of our collective commitment to children and families. There is so much going on. I've certainly learned a lot today. I am sure to learn more in relationship with all of you. There are a few things that I just wanted to raise up that really resonated with me. First, and key, partnerships and collaboration. And I would add also communication. These kinds of forums, I think, amplify, firstly, the tremendous passion that's demonstrated by all of you for the children and families that we support and the communities that we embrace. And so thank you all very much. So key. Family voice as being critical to this whole equation. Family voice is the bridge to all of the services and supports that we are trying to deploy and employ here. Response and flexibility to respond to various models. We don't know everything about the days, weeks, and months ahead. There are various models that we're going to have to respond to, and I think flexibility is key, and grounded in that communication, collaboration, and partnership, I do feel like we can be successful. Heard over and over again, social and emotional needs have to be met, and health and wellness needs have to be met for both children and the adults that are so critical in their lives. It has to be a whole community approach. And I am also a high proponent of nurturing the nurturers. Let's all on the phone and on the of the participants, all of us take care of ourselves too, as we take care of our communities and those that are providing care to others. Really huge amplification. Can't do this as well as we possibly can if we don't have the resources and funding that are so critically necessary to ensure effective and comprehensive and data-driven, research-based, science-informed approaches and response, we need to have the resources and funding in order to do this well, not only for today, but also as we re-envision a system for tomorrow. We have to give people space and grace. Gracie, thank you so much for that quote. A great quote to end on, and really appreciate everyone's participation. So Jennifer, I'll turn it back to you to close us out.
Sure. Thank you, Dr. Braga. Next slide, please. So you heard that there is a part 2, and we have that date on the calendar. So there'll be a continuation of this discussion with other voices from the field on August 27th. Confirmed panelists are After School Alliance, Programs for Parents, Incorporated, an amazing childcare resource and referral in New Jersey, and more. So mark your calendars for that. And in the meantime, next slide. We also have partnered with Opportunities Exchange to address a variety of topics related to business leadership. And together over the next few months, we're going to be addressing child care management systems, business training that really works, shared services, what are the benefits and what are some models, data interoperability, strategic cost modeling, staff family childcare networks, and all of that kicks off with this webinar series that you see on the screen. So we'll be promoting both the part 2 of this forum and these webinars through our regular communication channels. Please do check out our website for the latest information on these and other offerings from the Emergency Child Care and Technical Assistance Center and Childcare Wherever America. So thanks again for joining today, and until next time. Bye, everyone.